Hi, I'm Dr. Neil Schultz, and welcome to the June 2013 edition of BeautyRx Live, where on live streaming video I'll answer your questions about BeautyRx skincare products and any other related skincare issues. Just to remind you, BeautyRx skincare products are the patient-proven and award-winning products that have brought my patients more beautiful, healthier, and younger-looking skin for over a decade. They address the ageless issues of color and texture, as well as, of course, the important issues of lines and wrinkles. Now that BeautyRx skincare products are available to everybody, even people outside my office, even non-patients, we host BeautyRx Live to give you access to me to ask me questions about these products or about anything of related skincare issues. If you have a question, go to BeautyRxLive.com, use the chat box, just type in your question, and I will get to as many questions today as I can. Just as a side note, this month we're a little bit out of sync because last week was the viewer question week for both DermTV and DermTV.com and YouTube.com. But unfortunately, we postponed BeautyRx Live till this week for technical reasons. So this is not really viewer question week. And tomorrow, on Thursday, we will have a regular DermTV.com episode. And as a matter of fact, just as a little preview, we'll be talking about what is a serum. So getting to today's questions, the first question comes from Amy. Many celebrities talk about washing their face with baking soda. Is this a good alternative to glycolic? Amy, baking soda is fine for removing small impurities off the surface of the skin. It's not really a very good surfactant, and if it's not a good surfactant, it's not going to get rid of that much oil. And if you don't get rid of that much oil, which the dirt is usually embedded in, you're not apt to really get good cleansing. But baking soda certainly is not going to be an effective exfoliant. So if you want to use it for freshening, removing some fine particulate impurities, that's okay, but you're not going to get the results from baking soda in terms of exfoliation for either surface improvement in the surface texture, improvement in removing clogs and treating clogs and preventing them for acne, or in terms of removing the early abnormal cells that can go on to contribute to precancers and cause then squamous cell cancers. I have a question from Mona. I reapply my sunscreen religiously the way you explained on Derm TV, but I still get some color after being on the beach. Does this mean that the tan is safe? Mona, certainly the color that you're going to get while using a sunscreen is much safer and much less dangerous than the color that you'll get without a sunscreen. The tan is safer, but no tan is safe, meaning if your skin is tanned, which means it's been darkened, all darkening is a reflection of some damage to the skin. So there just is no completely safe tan. And some people just seem to have very, very reactive melanocytes, which are the cells that make melanin pigment, the brown pigment. So even with proper use of sunscreen, they still get some darkening. If you recall, I advise people, in addition to sunscreen, to help prevent photoaging and skin cancer, I advise them to use topical antioxidants every night, particularly vitamin C-based antioxidants. And the reason that we use them is because despite using sunscreen properly and despite using an effective sunscreen, as you are, somehow a little bit of that damaging UV radiation gets through the sunscreen, gets around the sunscreen, and that's what's happening here and causing some darkening in your skin. Now, there's some recent evidence that suggests that perhaps even some of the visible light, which your sunscreen isn't blocking, maybe some of the visible light is also causing some pigment darkening. And there's new research going on, and stay tuned. You'll be hearing more about that in the next year or two. I have a question from Regina. Do I have to use body lotion in the summertime, even if my skin doesn't feel dry? Regina, no, you don't need to use body lotion if your skin doesn't feel dry. Feeling dry is either the sensation that you've described or a feeling of tightness or the appearance of flaking. But if none of those pertain, then you really don't need to use a body lotion. during the summer or when your skin just doesn't feel dry. So again, I'm Dr. Neil Schultz. This is BeautyRx Live for June 2013. If you have a question, please go to BeautyRxLive.com. Just put your question into the question box, and I will get to as many of the questions today as I can. Lizzie asks, can I apply eye cream to my dark eyelids in addition to my under eyes? When you say my dark eyelids, if you're talking about the upper lids, I would suggest against using anything more than the lightest eye cream on your upper lids, because as you perspire, the gravity is going to pull some of that material down into your eyes, and it can be a little irritating. Even though all eye area products have been tested and demonstrated to not cause irritation if they go in your eyes, and they have a higher pH, so they're less acidic and therefore less apt to be irritating to that delicate eye area skin, I usually don't advise people to put skincare products on their upper eyelids. If we're talking about the darkening of the lower lids right below the eyelash line, sure, you can put your skincare products there, because again, if there is any sweating, we're not concerned about it, because it's going to move your skincare products away from your eyes, not toward your eyes. Lynn asks, I plan on traveling a lot this summer. Is there anything extra or different I should bring on my trip in terms of skincare? Well, Lynn, I think one of the most difficult things when people are traveling is that they get out of their usual routine of skincare. They're not getting up at the time they usually do. They're not going to sleep at the time they usually do. Their toiletries, personal products, skincare products are not in their usual places. Sometimes they're left in suitcases or just out of reach. And so people just don't tend to maintain their same skincare routines. So I think that the most important thing to realize is to anticipate that and to bring smaller packages in smaller containers of your daily skincare products, so you can put them in a small case that fits on the sink wherever you are, so you have access to all of them. But the second and probably even more important thing is that people tend to not get to refresh their skin, to cleanse their skin, to wash their skin with the same regularity, and that can lead to additional breakouts. So I suggest that people take pre-soaked toner pads with them. On BeautyRx, we have anytime pads, which are pads that you use to just freshen up anytime, particularly when cleanser or soap and water aren't available, and you just take one of these pads, which is like a thin cotton makeup remover pad, out of the case, which fits easily in your pocketbook or your pocket, and you use that for just freshening up your skin while you're traveling, so that you can remove dirt, oil, debris, air pollution, and things like that, despite the fact that you're just not getting an opportunity to do your usual routine of cleansing. Susan asks, is the skin on the neck too sensitive for glycolic creams and other exfoliants? Susan, it's not too sensitive, and we encourage people to use exfoliants, whether they're glycolics or other chemical exfoliants, on their neck, but just bear in mind that neck skin can be a little bit more sensitive than facial skin. So when you're starting your glycolic product, I would if you're using the same product you use for your face, I would use it on alternate nights for the first week or two, just to make sure that there isn't an undue sensitivity. And as with all skincare products, to test for sensitivity, take an area the size of a quarter or 2 or 3 centimeters in the same place on the side of your neck, and just put a little bit of that skincare product there the first 2 or 3 nights, just to make sure that there's no problem. Then go to the entire neck on alternate nights, and then you can apply your glycolic or other chemical exfoliant to your entire neck with the same regularity that you do for your face. So again, I'm Dr. Neil Schultz. This is BeautyRx Live for June 2013. If you have any questions, please go to BeautyRxLive.com and just put your question in the chat box, and we'll get to as many of your questions today as we can. Rochelle asks, I have been using a new brand for at least 5 weeks of skincare products, and my acne on my chin is much worse. Should I stick with it? Rochelle, this is an important issue, and I've actually covered it in a Derm TV episode, but the bottom line is you should never get worse on a new skincare regime before you get better, or you certainly don't need to get worse before you get better. Now, it could well be when you start a new skincare line or regimen, the reason you're starting is because your skin's in bad shape, because it is getting worse. So it's possible that your skin will continue to get worse or a little bit worse for a couple of days after you started a new skincare line, just because your skin was getting worse, and it takes a few days for your new line to kick in. But 5 weeks isn't a few days, and at 5 weeks it's time for you to go to different skincare products, because you shouldn't be getting worse at 5 weeks. You shouldn't be getting worse at 2 weeks, for a couple of days perhaps. June asks, I grew up hearing that a good moisturizer is necessary before makeup, not only because your skin needs the moisturizer, but also because it works as a barrier between makeup and pollution and the skin, preventing harmful chemicals from makeup and pollution to come in contact with the skin. Is there any truth to this statement? Recently, I started mixing my moisturizer and foundation to make tinted moisturizer. Great idea. Sounds like you're making your own BB cream. Is this bad because now some of the foundation comes in contact with the skin directly? It is not bad for your foundation to come directly in contact with your skin. Using a moisturizer may create a more even surface, so your makeup, therefore, or your foundation may take more evenly and look better. But there's nothing wrong with foundation, the chemicals in foundation touching your skin. In terms of the moisturizer helping to seal your skin or insulate your skin from particles of air pollution and things like that, sure, that's helpful. Anything that layers to protect the skin without clogging it is going to be helpful in terms of air pollution, ozone, dirt, grime, debris, and so on. So in general, moisturizer under foundation will help to protect the skin a little bit from extraneous things. I'm not concerned about the foundation itself, but will also help the foundation take more evenly. Dawn asks, does mixing my moisturizer with argan oil disrupt the effects of the moisturizer? It probably won't, but as you may know from Derm TV, I'm not the biggest fan of argan oil, and I'm always concerned about any extra oil being added to skincare products that can clog pores or aggravate acne. So while I don't think it will defeat the role of your moisturizer, I am concerned that it can contribute to breakouts if you are prone to acne or have oily skin. If you have a question, please go to dermtvlive.com, put it in the chat box, and I'll try to get as many questions as I can. Elizabeth asks, I've heard that foaming cleansers are bad for the skin. Is this true? Elizabeth, I'm not aware that foaming cleansers are bad. They have additional surfactants that give you the bubbles in the foam, and the foam is actually somewhat helpful in helping to remove additional dirt and emulsify additional oil having to do with the surface area, but I'm not aware of them being harmful or dangerous and have no problems with them. Foaming from things like hydrogen peroxide is different, and we don't like to use hydrogen peroxide on healthy skin, only on skin which has dirt or impurities in it. But as far as foaming cleansers go, I think they're in. Jack asks, Jack says, I have normal skin. Should I use light rehydrating lotion or nourishing moisture cream? Jack, if you have normal skin, in the summertime, I would suggest light rehydrating lotion because it's warmer and more humid. In the fall and winter, I would suggest nourishing moisture cream, which is a little bit heavier because it's colder and drier in the fall and winter. But I would try them both and see which feels best to you. But that would be, again, part of the seasonal variation in changing the vehicle of our skincare products as we go from spring and summer into fall and winter. If you have any questions, you can go to BeautyRxLive.com, use the chat box, and I will get to them as soon as I can. Just bear in mind that as summer is finally in full progress, that you need to use sunscreen every day, rain or shine, even if you're not going out, because UVA comes through window glass and it can still adversely affect your skin. And we know that UVA is the type of ultraviolet that contributes to both premature photoaging as well as skin cancer. Okay, so the last question that we're going to take today is going to come from Gretchen, and she says, can I use a spray sunscreen at the beach this summer? Gretchen, sure you can, but I'll tell you that in my office, the worst sunburns that I see are from people who've used a spray sunscreen, because it's very hard to keep track of where you've put it and where you haven't. So often when people get burns with after using spray sunscreens, they have these big streaks across their body because they sprayed up here and they sprayed down here, but they didn't spray there. So I am not a big fan of sprays, and I believe that with the new sunscreen labeling laws that will fully kick into effect this coming December, I think that sprays will have to have additional testing to them before they can be promoted. So that's it for the June edition 2013 of BeautyRx Live. Thanks for joining us. Please keep sending in your questions. The basis of your questions become so many of my Derm TV episodes, and I'll see you next month.